Hi, this is Dr. Kurt Wohler for Functional Medicine Clinical Rounds. This is a lab review video example. The title of this short video is Organic Acids Test Folate Metabolism Markers. So the Organic Acids Test from Great Plains Laboratory provides a lot of detailed information with various organic acids that are linked to different types of metabolic imbalances. There are other types of organic acid tests that also come from other companies. So this information, if the markers match up, could correlate with other labs' organic acids tests as well. But we're going to be reviewing what's called the pyrimidine section of the organic acids test from Great Plains Laboratory. So the folate metabolism section, also called pyrimidine metabolites, looks at two specific markers, uracil and thymine. Now these can be elevated in people who have a folate deficiency. That could occur either because of an absorption problem, perhaps a metabolic conversion problem. So whenever you see one or both of these high, it's indicating that there is some type of folate metabolism problem. So if we first just look at DNA, so we have this double helix, and in DNA there are four different types of nucleotides: adenine, thymine, cytosine, and guanine. Now adenine pairs with thymine, cytosine pairs with guanine, and this pairing is, what is considered to be the nitrogenous base configuration of these base pairs that carries genetic information. So on the organic acid test, thymine, which we pick up on the oat, is going to be linked to DNA. And then we have ribonucleic acid, or RNA. And the nucleotides found in RNA are adenine, cytosine, guanine, and then uracil replaces thymine. So on the oat test, you'll see uracil. So in that pyrimidine section of the oat, we've got uracil and thymine, uracil being linked to RNA, thymine being linked to DNA. And there are different types of RNA, right? We've got messenger RNA, transfer, ribosomal RNA. And from a genetic standpoint, it's all about DNA synthesis, so replication, transcription, where the RNA is then transcribing that information, and then we're getting protein synthesis or protein production to then move throughout the body and support things from a cellular metabolic standpoint, immune system, hormone system, etc. So as a group, pyrimidines, again, are found in DNA and RNA. Pyrimidine as a chemical is what's called an aromatic organic compound, which contains this heterocyclic ring with specific nitrogen atoms at position 1 and 3. So that is characteristic of a pyrimidine. And so we know there's three types of pyrimidine nucleotides. These sometimes are also called nucleobases: cytosine, thymine, and uracil. Now, there are examples of pyrimidine all throughout nature. One of the examples would be thiamine, right? So vitamin B1 actually has a pyrimidine type chemical structure. And then there are certain medications which also contain pyrimidine. So barbiturates, for example, or AZT, the medication for HIV, is a pyrimidine. Now, uracil is one of the nucleobases of RNA, so it actually replaces thymine. Its name actually comes from uric acid. It was named that after a German chemist was trying to synthesize uric acid. And so uracil pairs up with adenine. So it's basically replacing thymine. So thymine would be in DNA, uracil is in RNA. Now the methylation of uracil actually produces thymine. And so this process is actually felt to preserve DNA stability and may even improve the replication of DNA. Thymine is the nucleobase of DNA. Okay, so in DNA we have thymine, guanine, cytosine, and adenine. Thymine actually got its name from the thymus gland, which is where it was first isolated. And so again, when uracil is methylated, what happens is it gets methylated at the 5th carbon, it produces thymine. And there can be problems that occur in thymine, for example, something called a dimer, which is when you get two identical chemicals being linked together, that starts to create a problem in DNA synthesis. And so a medication, for example, this 5-fluorouracil, or 5-FU, is used in cancer treatment because what it does is it inhibits DNA synthesis and then, decreases the dividing of cancer cells. So basically it goes in and helps to short circuit this dimer effect that is occurring with things like thymine, for example. So all of these things have a relationship to folate, and we get natural folate from our food, and we know that folate as a chemical also is very important in the methylation cycle. So folate, for example, methylates the methionine synthase enzyme complex that helps to convert homocysteine to methionine. And there are different types of folate. So for example, folinic acid as a supplement, for example, is very versatile in its use. Then you have synthetic folic acid, and then of course we've got L-methylfolate, which is the active form of folate. And so the chemical structures between folinic acid and L-methylfolate are relatively similar. There's a different absorption capacity from the gut. And one of the reasons folic acid is often used as a synthetic vitamin is because it actually has very high absorption. And so biochemically, if we just keep things organized to the fact that folate as a group in general has a supportive role in helping with things at the DNA, RNA level. So we can get there by using 5-methyl THF, or what's called 5-methylfolate. Okay, so that biochemically can eventually go off to support DNA synthesis. We can also get there with folic acid. There's some biochemical steps that have to take place in order for that to happen. And then we can also get there with folinic acid. Folinic acid actually is a precursor to this chemical here called 5,10-methylene THF. And so that too can go off to support DNA synthesis, RNA synthesis through pyrimidine metabolism. So when you understand the relationships of what you're seeing on the test to what we can do nutritionally from a supplemental standpoint, you can really help patients and understand things a little bit more biochemically of where things fit in from a nutritional standpoint. And so as I mentioned before, there are many different types of organic acid tests come from different types of functional medicine companies. The one we've been discussing here is from Great Plains Laboratory. But just remember, when you see an elevation of uracil or an elevation of thymine on this test, you're looking at, in this particular individual, some type of folate problem. Okay, again, it could be a lack of folate in the diet, could be an absorption issue, but you're dealing with somebody who is compromised from a folate metabolism standpoint. If you have any questions about the content of this video, you can reach out to us through the Functional Medicine Clinical Rounds website, through the Lab Advising Service, or the member forum that is part of this website. Again, this is Dr. Kurt Wohler for Functional Medicine Clinical Rounds. Thank you.